Hey, welcome back, my informed Medicare members. This is Aaron Beaver here with more informed Medicare information for you. Specifically, the number one request I get when members call in about how to get money out of their plans. You heard it right, how to get cash from your Medicare health insurance plan. It is possible. You will see commercials all the time about this plan gives you $200 back. This plan gives you $300 back. This plan will give you a card to help pay for your rent, for your utility bill, or your grocery bill. That's number one what people want, a card to pay for their groceries. It is almost nonstop how many times I get asked for this. So I want to explain what it takes, because it's not for everyone. Those commercials do not apply to everyone. You're not going to call in and automatically get $350 every month on a Visa card to spend for your groceries. But you can try. And that's what I want to tell you about. How you can call and see if there's a way to change your plan that's paying for your medical bills and goes along with Medicare into one that also helps pay for your utilities, your rent, or your groceries. This way is called a health spending account card. And it's only offered in what are called special needs plans. So these are Medicare Advantage plans, and they have this special symbol at the end of it, SNP, for Special Needs Plan. And there are two types. The first one, most who have this know about it. It's called a dual eligible special needs plan. And this is for those who have both Medicare and Medicaid. Now, when you have both, they work together with the insurance company to give you additional benefits. Medicaid pays all your co-payments. The insurance company will give you dental, vision, hearing, and also likely a spending account card. Now, the spending account card has been more restrictive lately, especially in 2026. You now have to have at least one chronic condition, meaning you have diabetes, or you have a heart condition, or you have one illness that just goes on and on and on, in order to qualify for that money to be spent for groceries. Otherwise, it can be spent for just over-the-counter products, like toothpaste or cold medicine or vitamins. So one way to get the spending account card is by having both Medicare and Medicaid and at least one qualifying chronic condition. Call your agent in your area to find out how much you can get. The other way, and this one's a little lesser known and very important to ask about, is called a chronic special needs plan. Now, a chronic special needs plan only exists in certain areas, so it's not available everywhere, but you certainly should ask about it. If you have a chronic condition, like I mentioned before, diabetes, heart conditions, had a heart attack, sometimes even high blood pressure or high cholesterol can qualify you for this. Just some chronic illness that continues over time that it shows up in your medical record. If you have a chronic illness, then you're eligible for a chronic special needs plan. Now, the chronic special needs plan works just like a regular Medicare Advantage plan, but most of the time provides an additional spending account card. And this is what we're trying to get, the spending account card, so we can pay for groceries. You can use it towards your light bill, or you can help pay your rent with it. It's a legit Visa card they'll send to you, or MasterCard, who knows. So, two ways to get spending account cards. Either your Medicare and Medicaid dual eligible. If you have that, then you probably already know that you can get this benefit. But the hidden way is what's called a chronic special needs plan. And these only exist in certain areas, so you have to call and find out, or go on Medicare.gov to find out if there's a plan in your area made for those who have chronic conditions. These plans are tailored towards those chronic conditions. There might be one for diabetes, or one for heart conditions, or one for those who have COPD, or one for those who have end-stage renal disease. Any kind of chronic condition, the plan is tailored for that. So you get benefits based off of what you're needing most. Also another good thing. But what we're trying to get is that spending account card. This comes in the chronic special needs plans and is a Visa or MasterCard that you can use towards utilities, groceries, or even your rent. And you want to ask about this immediately because you have the month of January, February, and March to change your plan to a chronic special needs plan if you have a chronic illness, and therefore you can qualify for money on a credit card to help pay your bills. Thanks.